Did you know that more than 70% of people in America do not walk correctly? Do you know if you walk correctly? Well, stay tuned because today we're going to talk about how to walk correctly and how not walking correctly can create more problems in your feet and in your knees. Stay tuned. Hey, I need you to do me a quick favor. I've noticed in my analytics about 88 to 89% of you, while it's improving, still have not subscribed to my channel. And while I'm greatly appreciative of you watching my videos, I want you to get all the information possible to help you in your life. So please, please subscribe down below. It's a little button down below with the lights running around it. Make sure that you ring the bell so that every week when I come out with a new video, you'll get notified. And let's stay on track and get your body back into a better place. Thank you. Welcome back to the Muscle Repair Shop. Did you know that the way you walk can determine how much foot pain and knee pain that you have every day? Now, some of you have gone out and bought shoes because your arches are sore, or your heels are sore, or your knees are hurting. Maybe even your hips are hurting. Did you know that actually the way you move with your feet and your lower legs can actually cause head forward posture and neck and shoulder pain? We're going to talk about all of this today because I want you to fully understand how important your feet are. They're an amazing part of your body. So let's dive right in. Each foot has 29 muscles, 26 bones, and believe it or not, 33 joints. Why is that important? So when you step down on your foot, the arch then, in other words, if you step down this way, the arch has to flex flat so it absorbs the impact to the ground, which protects your knees, hips, and back, okay? Now, when you also step down, the toes have to be able to spread, which means when you buy a shoe, it needs to have a wider toe box to give your toes room to spread and without having any arch support at all in the shoe so that the arch itself can flatten out. That's how important the muscles and the bones and joints in your feet are to your balance. Now, for some of you who are getting older who have balance issues, you may think or may have even been told that that's an age-related process. That's not necessarily true. What I find with patients of mine who are 60 and above, typically their feet are very hard, they're very thick feeling, and there's no give at all, not only in the foot, but also in the ankle. Very few people talk about the ankle, but the ankle is a very important part of the body. So when you look at your lower leg, we think of a calf muscle as one muscle on the backside of our lower leg. But there's actually 4 calf muscles back there, and those calf muscles control the foot laterally, vertically when you're walking, but laterally for balance, and also rotationally. So heads up here, golfers and tennis players, if you're dealing with back pain when you're playing golf and tennis, chances are your calf muscles and your 3 hamstring muscles are tight. And when they're tight, it's forcing you to rotate the hips with your midsection of your body, which increases compression on your back because the calf muscles are tight and the hamstrings are tight. But today we're going to focus from the knee down. That's the most important part of the human body because that creates your mobility and it literally keeps you alive by movement. So when a person is walking, what you want to be able to see is as they take a step forward, they're going to bend at their ankles on the back foot. And that back foot allows them to propel themselves. So think of it this way. When you watch an ice skater pushes off to the left, catches with the right, pushes off with the right, catches with the left foot. Well, when we walk, it should be very similar, but instead of going side to side like that, we can go forward one in front of the other. Now, how do you do that? So when you're starting to walk, notice, and I would practice barefoot in the hallway, but notice that you're pushing off from the back foot and then catching yourself with the front foot. That's important because for so many people, young and old, when I watch them walk, they're reaching out with the front foot and pulling themselves forward with their quads, which is the front of the thighs. That's going to lead to low back pain and also head forward posture because when you reach out with that foot and you're pulling yourself forward, your head will naturally go forward which increases the compression on the entire spine because the weight of your head weighs about 10 to 12 pounds. Every inch it goes in front of your chest, that weight increases by 10 pounds per inch. So the calf muscles can literally create neck pain and mid-back pain. Keep that in the back of your mind. When we look at shoes, and that's the question I get from people all the time, what shoes should I wear? When we look at shoes, shoes are designed to treat symptoms. If my arches are sore, I'm going to have arch supports or orthotics in my foot so that my arch muscle doesn't have to move. Here's a question. If the muscle doesn't move, we all know that that muscle is going to atrophy and get weaker, right? Well, if the muscles in your feet get weaker, how in the world are you going to balance and be able to walk any distance at all without pain? Secondly, if the toe box on the shoe has a more pointier look to it, and especially the ladies, high heels with those sharp pointy toes, oh my God, what it does to your feet. I mean, I see it in older businesswomen today. Your feet are just dying inside these shoes. I don't care how stylish they look, and I know most women hate to hear that, but when you wear pointier toe shoes, and men, the same thing for you in cowboy boots or pointy toe business shoes, you're setting yourself up for bunions, and you're setting yourself up for Morton's neuromas, and possibly later on even getting into neuropathy, because the ball of your feet, which are the knuckles of the toes, are getting squeezed together, pinching nerves in your feet. And yes, you do have nerves in your feet. That's how you feel the ground, all right? When your feet or their toes are able to widen and the muscles are softer, now when you walk on any surface, I don't care if it's concrete or sand, your feet have the ability to grip the ground and also feel and balance you so that you feel steadier when you're walking. So there's a couple of things that I want you to do here. Number one, every evening you should really be massaging your feet. On the bottom of your feet, you're going to massage in the arch area. And again, you're not pushing hard. I don't want you to bruise your feet. I mean, that's the thing. People get into the massage part and they think they have to brutalize their body to force that muscle to do something. All you want to do is put enough pressure you can start to feel just a tiny little bit of discomfort. Breathe out, relax, and relax the muscles in your feet. And do that for about 5 or 6 seconds. And allow the brain to reduce the tension in those muscles in your feet. And then move to the next spot. And you'll do that all over the arch of your foot. On top of your foot, you're talking about muscles in between the toes. You can see the bones in most of our feet. And what we want to do there is we want to work from our toes back to our ankle in between those bones to soften our feet. Now what that's going to do is reduce swelling in the feet to some degree, because as you start to free this tension up, it allows what's called the lymphatic system to take the swelling or the edema out of the foot itself to allow you to be able to use your foot. The second thing you want to do, now we're going to move into the calf area, is to get a yoga strap, a rope. I usually use yoga straps. They're about 8 feet long. Don't use anything that's elastic. That's a strength training tool, so you're not going to stretch anything. But something that's not elastic, that's about 6 or 8 feet long, and put that around the ball of your foot. Now, when I do mine, I'll sit on the floor with my back against the wall, because it's important that my back is 90 degrees to my leg, the one leg that is out in front of me, that is straight. If you have a difficult time of sitting like that, now you can also, if you can't get on the floor, don't fret. You can sit in a hardback chair like a dining room chair, put your foot up on an ottoman, just as long as your back is 90 degrees to your leg. For some of you, just getting in that position is a challenge all by itself. So forget about the yoga strap and the rope. At that point, if that's you, allow the leg to just gently start to relax and get used to your leg going down to where it becomes flat. Now, once you get there, now you can move to the next step, which is the yoga strap or rope. And we're going to use that and put that around the ball of your foot here. And as you do that, you're going to inhale through your nose, breathe out through the mouth as you gently pull the toes back towards you. Don't try to go from A to Z in one fell swoop if you've never done these. Take your time. I don't care if it moves a half an inch. Take your time with baby steps, because we don't want to scare your brain, because your brain is anticipating pain. Allow the brain to see that that is not dangerous for you. And when it does, the brain will release the muscle and allow you to stretch your body out. It'll take some work here. You'll do that 10 times, bringing the toes straight back towards you. Now, rotate the foot inward, the whole leg rather, the whole leg where the foot goes inward, and do the same thing again to get the outside calf muscle. And then rotate the leg outward to get the inside calf muscle. And I'll put a link down below so you can see the full stretch there in the description. But what you want to do there is you want to loosen up all 4 of those calf muscles so that when you walk, you can bend your ankles. You want to wear shoes that bend at the arch. Every shoe pretty much bends at the toe. There's a few of them that don't, and trust me, there's some name brands out there, and I'm not going to mention any names. Really thick soles, you're putting your foot in a cast. Please, please don't do that. You want a shoe that has a thinner sole that can literally bend at the arch so that your ankles can bend. If it can't bend at the arch, your ankles are prevented from bending, and that's going to lead to low back issues, knee issues, neck pain possibly for you as well. It is really, I mean, it sounds kind of weird because you always hear people say, never walk barefoot on hard surfaces. I'm almost 65 years old. My wife is over 70, and we both walk on tile floors barefoot virtually every day. And it's like I have no pain in my feet. And so the thing is if you keep your feet healthy and keep your lower leg healthy, you can do that. Your calf controls your foot. Never forget that. When you have problems in the heel, like plantar fasciitis, the heel is not the problem. The upper calf muscles are the problem because you want to allow that ankle to bend so that the heel can come down without pressure. If you have sore arches, or if you pronate or supinate, that is a calf issue. That's not a foot issue. You can put whatever you want in your shoe, but chances are you may hurt your knee down the road. That is a calf issue. I've seen it hundreds of times. So anyway, if you like this, please subscribe down below, ring the bell so you can get more notifications. And as always, leave comments, ask me questions. I know this flies against what everybody else tells you on YouTube and around the world, but I'm telling you, I've seen people with things like plantar fasciitis have them go away in 2 to 3 days, and they've been dealing with it for months. I don't understand the misconception about that, but please, again, subscribe, ring the bell, leave comments, and share with your friends. Thank you. I hope you enjoyed this last video. Be sure to click on the video here to my left and enjoy.